Hello, everybody, and welcome to the Tuesday edition of Video Clips. And I'll share some things with you. Lots of free stuff, some paid stuff. I think more free than paid, actually. For those of you who are curious about collagen, tonight is the workshop at 8 p.m. Eastern, I believe. And you do need to be a member in order to participate in that workshop. But lots of people are curious about collagen and collagen supplements. They're heavily advertised, and I think that's one of the reasons why people are kind of curious. Free preview for non-members. I have started doing this a couple times a month because people really enjoy seeing our websites and our libraries and finding out how membership works. And then I engage in a very 20-30 minute Q&A, general health talk, which is similar to the types of things that you have access to as a member. So you get a little bit of a freebie session. And I have one scheduled for May 13th at 11:30 and May 25th at 7 p.m. May 17th is our next dinner in Columbus in Central Ohio. So if you live in driving distance, you definitely want to join us because the food's great. And I wish I could feed you virtually, but I can't. However, you can listen to the lecture remote. So feel free to send an email to pampopper@msn.com if you would like to join for the lecture and Q&A. And we do these once a month and free to the public. Healthcare professionals, we have a lot of things coming up. On the 18th, independent practice tips, and on the 25th, the sample class. And don't forget the diet and lifestyle intervention course, one of our professional development courses, amazing course, 15 modules. I have never had anybody, including medical doctors, take this course that didn't say it changed their whole life, right? So that's coming up, starts in the summer. And that you have to pay for, by the way. The workshops that I described for independent practice and that sort of thing, those are free. Next, I think in 2 weeks, we're going to study this book, Toxic Legacy. I've been working on it, looking up the references. It's an interesting book. It's filled with inaccuracies, which I'm going to point out to you. But we're going to have a real interesting discussion about glyphosate, the real truth about glyphosate, which is, I guess, what we specialize in here. And then what else have I forgotten? The cancer boot camp is May 15th. So there were 3 boot camps that are short versions of long courses that I teach. One was, what do they do? Oh, research and writing. Another was the vaccine course, and that was last night. And the third one is the cancer one. Now, if you wanted to look at those others and you couldn't join, or you decided, gosh, I wish I had, we do video those, and you can watch the video. And so let us know if you'd like to do that. Once again, my email address is pampopper@msn.com. So the topic for today, according to a recent overview of systematic reviews, exercise can be more effective than medication for the treatment of depression, anxiety, and psychological distress. 97 systematic reviews that included meta-analyses of over 1,000 trials, and over 128,000 participants were included. The cohorts were healthy adults, people who've been diagnosed with mental health issues, and people with various chronic diseases. So why this is important, let's just start with the scope of our mental health problem, not just here in the United States, but worldwide. In 2019, 1 in 8 people, or 970 million humans worldwide, had a mental health disorder. Almost 44% of all people on the planet are expected to experience some type of mental distress sometime during their lifetimes. The COVID-19 debacle increased the rate of psychological distress by an estimated 35 to 38% worldwide. So it was bad before, it's worse now. The role of lifestyle in addressing mental health issues varies depending on location. Here in the United States, we tend to drug people, sometimes therapy and drugs. And then any type of diet and lifestyle component is an adjuvant and oh, by the way, kind of thing. In countries like Australia, lifestyle changes are recommended first, but in practice, that's the way it's supposed to be, but in practice, a lot of patients end up medicated anyway. Hundreds of trials have looked at the effect of physical activity on depression, anxiety, and other psychological issues, with many showing that the effects of exercise are similar to or even better than treatment with drugs. And when you think about it, exercise is a whole lot less expensive and the breadth of the effect is greater. It has a positive impact on weight. It reduces the risk of many diseases. And to the extent that weight is so much related to diseases, you get a lot of bang for the buck with exercise, and it decreases the risk of age-related disabilities. So now let's get down to the results of this study. The greatest benefits of exercise were for depressed people, pregnant and postpartum women, people with kidney disease, and AIDS. Higher intensity exercise was associated with greater improvement in depression and anxiety. Physical activity was effective for reducing depression and anxiety, accompanying all clinically diagnosed conditions, but the magnitude of difference varied. All types of exercise were beneficial, including aerobics, strength training, yoga, and mixed mode exercise. Resistance training had the biggest effect on depression, and yoga and mind-body exercises had the biggest effect on reducing anxiety. Moderate and high intensity exercise was more effective than low intensity, so that indicates a dose-dependent relationship, which always strengthens the relationship. The mechanisms of action are well understood. Increased production of brain-derived neurotrophic factor, increased availability of serotonin, norepinephrine, reduced systemic inflammation, regulation of the hypothalamic pituitary adrenal axis activity. And in fact, I had researched this topic in depth when creating a course called Diet, Lifestyle, and Mental Health a few years ago. I found significant evidence showing that exercise had a very positive effect on mental health due to other factors too. It improves sleep, it improves energy and alertness and self-image. I also found evidence from long-term studies showing that the effect is long-lasting. In other words, as long as the person continues to remain physically active, it's sustained. And I found many studies showing that exercise was indeed more effective than drugs. In fact, you may have noticed lately that there are a lot of drugs on television, drug ads on television, I should say, promoting drugs for people who are taking an antidepressant and who remain depressed. There must be a big market for it because I don't watch much TV, turn it on for maybe a half hour before I go to bed to play with Winston. To wear him out a little bit, and I've seen like 2 or 3 every single night. So Rexulti is one of these drugs advertised to reduce depression, an extra 62% when you take it with an antidepressant. So I went to the company's website, the drug's website. This drug's supposed to be for people who remain depressed after taking an antidepressant for 2 months or more. The drug was studied, very limited, by the way, 2 6-week clinical trials with a little over 1,000 patients diagnosed with major depression who had taken an antidepressant for 2 months. They used the Montgomery-Åsberg Depression Rating Scale, which ranges from 0 to 60 points, and patients taking Rexulti still remained depressed. I mean, it was indeed a reduction expressed in relative rather than absolute reduction. It's really not 62%. But the things that I found interesting on the website that I want to relate to you, and then I'm going to come back to exercise, is first of all, in order to get those less than spectacular results, they had a screening period of 1 to 4 weeks before the trial. And what I've come to learn that means when you're doing drug trials is a run-in period where you get rid of your placebo responders and your drug non-responders so you can really show that the drug works. Now, listen to the side effects for this less than impressive response. They include suicidal thoughts, cerebrovascular events, including stroke, neuroleptic malignant syndrome, and the symptoms associated with this include muscle rigidity, altered mental status, evidence of autonomic instability, tardive dyskinesia, hyperglycemia and diabetes, weight gain, pathological gambling, and other compulsive disorders, leukopenia, neutropenia, orthostatic hypotension, and syncope and seizures. Now that's the short version because the long one goes on like for a long, long time. So I think exercise is a better idea. I mean, almost anything is a better idea than these drugs, which part of the problem is they were developed based on the false premise that chemical imbalances in the brain are the cause of psychological distress, and that's simply not true. So you can't expect the drugs to work if the underlying premise is incorrect. I mean, that just makes sense, right? So exercise, diet, good therapy. There really is room for therapy, and good therapists can help you a lot in a short period of time. We have one of those associated with us as an affiliate who offers a lot of great classes, by the way. on coping with stress and dealing with current events and all kinds of things that I think are really, really helpful. So anyway, the drugs, not so good. Exercise, diet, and lifestyle change, much better if you are in some form of psychological distress. And I can just speak from personal experience. Sometimes when I am the most sideways, a really good run outside on a sunny day or a yoga class gets me right back into a really good frame of mind. And I think most people who regularly exercise would say the same thing. All right, that's it for today. As usual, pass this on to anybody who you think would enjoy watching it. And I'll be back to you tomorrow with more news.